5 heart health metrics every executive should track. Keep a close eye on key heart health metrics is vital for busy professionals. Heart disease remains the leading cause of death for men and women in the United States, and many risk factors go unnoticed until they cause serious problems. By proactively tracking certain metrics, executives can catch early warning signs and take preventive action. Below are 5 heart health metrics to monitor: blood pressure, cholesterol, coronary artery disease, coronary calcium score, VO2 max, and resting heart rate, along with what they mean and why they matter. Each metric provides insight into cardiovascular health, helping you and your healthcare provider make informed decisions based on the latest medical guidelines and research. Chronically, elevated blood pressure strains the heart and significantly increases the risk of heart attack, heart failure, stroke, and kidney problems. When blood pressure is too high, it injures the artery walls and accelerates plaque buildup, causing arteries to narrow and stiffen over time. This is why controlling blood pressure is a cornerstone of heart disease prevention. What is normal versus high? Blood pressure is measured in millimeters of mercury and recorded as systolic over diastolic pressure. Example, 120 over 80 millimeters of mercury. According to the current guidelines, normal blood pressure is under 120 over 80 millimeters of mercury, and this is considered optimal. Cholesterol, why it is important. Cholesterol levels, specifically your LDL and HDL cholesterol, are key predictors of cardiovascular risk. Cholesterol is a waxy, fat-like substance that your body needs in small amounts, but too much of the wrong kind can be dangerous. LDL, low density lipoprotein cholesterol, is often called the bad cholesterol because excess LDL tends to deposit in the artery walls, forming plaque that can narrow or block blood flow. High LDL cholesterol is directly linked to a greater risk of heart disease and stroke, as plaque buildups in coronary arteries can trigger heart attacks and in cerebral arteries can cause strokes. HDL, high density lipoprotein cholesterol, on the other hand, is known as the good cholesterol. HDL particles help remove cholesterol from the bloodstream, ferrying it to the liver for disposal. Higher levels of HDL are protective, associated with lower risk of heart disease and stroke because HDL helps prevent plaque formation. Understanding your numbers. A standard lipid panel measures total cholesterol, LDL, HDL, and triglycerides. Optimal level for most adults are LDL around 100 milligrams per deciliter or lower, HDL at least 40 milligrams per deciliter in men and 50 milligrams per deciliter in women, triglycerides less than 150 milligrams per deciliter, and total cholesterol around 150 milligrams per deciliter. In practice, the lower your LDL, the better, especially if you have other heart risk factors.